I'm here today to get my under eyes fixed. I have really dark circles under my eyes. I'm here to get stem cells and fat transferred there so that the darkness goes away and they are more bright. I've done a ton of research. I'm a board certified endocrinologist and I'm a functional medicine doctor. I deal with a lot of people with autoimmune issues. I have some autoimmune issues. I see so many issues in people who have other procedures where they put something that is not theirs in their body and then they have terrible outcomes. Maybe it doesn't take, or whatever they put there migrates and moves, or they end up having areas where I think they call it tindling, where it like pools and it just doesn't look as natural. I wanted something that would fix this for a long time and I was not going to have a reaction to. I know that when you use your own stem cells and your own fat like Dr. Newman does, I'm not going to have a reaction. I'm not going to have all these terrible migration issues. This is the first time I've ever been here. I actually live in Oklahoma City. I met Dr. Newman at Mindshare, so a medical conference, and I met him through Nicole McPherson. I've looked at his stuff and I think that what he does is really amazing. His skincare line, all of it, I think is state of the art, the forefront of medical education.
Hello.
Hi.
How are you?
I'm good. How are you?
Good to see you.
Me too. I'm ready.
I'm ready. You're like the perfect candidate. You don't like this. Most of that is shadow effect. If I press, you see it doesn't really blanch. Not a lot of red cells. I think once we do it, it'll get a lot lighter. You see this? That's what the eyeball sits on. You've lost this volume here. Fill that out. You won't have this shadow in the valley of that. Goes away. That pocket of fat disappears. Once I fill it, you'll look the same way when you're looking at it. You won't have that valley over there. And that'll make you look a lot younger. You have a little bit of redness here. You see that? Mm-hmm. Maybe the laser will help that, so you won't have this blood vessels.
I just want it to be a lot brighter.
Yeah.
You know, like how people's eyes are bright.
Yeah.
Mine are never bright.
Well, we're gonna make
even when
that
I'm well rested.
That's the thing. You're gonna look rested. I just want to make sure if I stretch it, you see that redness. You see the blood vessels are right there. So I'm gonna laser that for you. I'm gonna laser it. We're gonna do the stem cells, and then I'm gonna do a stem cell peel. Even brighten it a little bit more.
Love it.
Where do you have fat for me?
So I have some.
We talked about doing
I
that.
have one here that's kind of messed
So we're gonna
up.
look at it. If I can fix this, that's just the bonus, and we'll do that.
Great.
You're gonna have two parts of this. One is the numbing and taking out the fat. So you're gonna be sore wherever I do that for a couple of weeks, like you had a muscle workout soreness kind of feeling. That goes away, and usually it's not a big deal. That will probably be more sore than the face. But the face, you're gonna get swelling, probably 2 weeks. The bag that you had may be a little bit more noticeable because of the swelling, and then it'll go down. Putting in cannula there, so it makes it swollen. You're gonna get inflammation from all the stem cell stuff. Questions, concern, easy. Let's go do it.
Let's do it.
We're gonna make sure she's comfortable and resting before we
Don't buy
start.
anything super expensive.
Big purchases that I've been waiting to do later today when she's in.
Oh, when she's on the pill, have her sign whatever you want. She'll remember anything.